What imaging maps liver cancer tumor spread accurately? Understanding how liver cancer spreads is crucial for doctors to decide the best treatment plan. To do this, they relying on several imaging techniques that help visualize the tumor and any spread beyond the liver. Each method has its strengths and limitations, so often they are used together for the most accurate picture. Computed tomography scans are one of the most common tools. They use X-ray technology to produce detailed cross-sectional images of the abdomen and chest. These images show the size and shape of the primary tumor and can reveal if the cancer has spread to nearby organs or lymph nodes. When contrast dye is injected into the bloodstream during the scan, it enhances the images, making it easier to see blood vessels and determine if the tumor involves them. Because CORT scans are quick and widely available, they are typically the first step in staging liver cancer. Magnetic resonance imaging offers a different approach. Instead of X-rays, MRI uses strong magnets and radio waves to create high-contrast images of soft tissues. This makes MRI especially good at detecting small tumors or metastases that might be missed on a CORT scan. Certain MRI techniques, like diffusion-weighted imaging, measure how water molecules move within tissues. Tumors tend to restrict water movement due to their high cellularity, helping radiologists distinguish between benign and malignant lesions. MRI is often used when more detailed information is needed or when CORT results are inconclusive. Ultrasound is another useful tool, especially because it is accessible and does not involve radiation. Standard ultrasound can identify liver tumors and guide biopsies. When combined with contrast agents, called contrast-enhanced ultrasound, it improves visualization of blood flow within the tumor. This helps differentiate between benign and malignant lesions. While ultrasound is less sensitive than CORT or MRI for small metastases, it is valuable for initial screening and real-time assessment. Positron emission tomography scans, often combined with CORT in a PET-CT scan, are excellent for detecting cancer spread beyond the liver. They use a radioactive tracer that accumulates in areas with high metabolic activity, which is typical of cancer cells. PET-CT scans are particularly helpful in finding distant metastases in bones, lymph nodes, or other organs, especially when there is suspicion of widespread disease. Bone scans may be performed if there are symptoms suggesting that the cancer has spread to the bones. However, this is less common in liver cancer unless specific signs or symptoms are present. In summary, CORT and MRI are the most accurate imaging methods for mapping liver cancer spread within the abdomen and liver itself. MRI, especially with diffusion-weighted techniques, is better at detecting small metastases. PET-CT is the best choice for identifying distant spread. Ultrasound and contrast enhanced ultrasound are useful for initial evaluations and guiding biopsies. The choice of imaging depends on the clinical situation, the availability of technology, and the need for detailed information. Accurate imaging helps doctors stage the cancer properly, which is essential for choosing the right treatment and improving patient outcomes. Always consult healthcare professionals for personalized advice and diagnosis.